uricase in the first place?
These are all inborn error of metabolism. Some people are born to be like that. So a lot of us are not aware that we have some form of an inborn error metabolism unless they present to you, for example, recurrent uric acid stone. So obviously when the patient comes to you like every 6 months with the kidney stones, for example, in my field, then I would definitely want to do a stone analysis and metabolic workup. It's from there that we picked up that, okay, this patient actually have this disorder.
Is it reversible? Can the body reverse the deficiency? No. It's not reversible.
Yeah.
Too bad. Then next question, do you treat patients with elevated blood UA but with no gout symptoms?
Treat patients with
elevated blood uric acid but with no gout symptoms?
I would say I will, simply for the fact that you do not want to wait until something has happened. For example, the crystal already deposited in the joint and give you arthritis or even stoned in the kidney, then you treat the patient. I would say prevention is always better than treatment. So if you were to ask me, in my case, I think that I would actually treat the patients to reduce the uric acid level and make sure that it stays within the normal limit, so that the patient won't suffer from the consequences. You know that the uric acid crystals can deposit in the lung, in the eye, in the bone, so there's so many things. So I would rather keep it within a normal range. Yeah.
Okay. And recently there are some cranberry is widely promoted. Can cranberry prevent some formation? The stone formation?
Cranberry. Well, I think cranberry, there are very debatable research on this cranberry. Cranberry is actually advocated in the European guidelines as a form of a prevention for recurrent urinary tract infection. So it's actually very widely used in European countries. But there are also studies that show that cranberry actually increases the uric acid level. So I would say that at this moment of time, I wouldn't really want to comment too much about it because this, at this point, is still very debatable. Yeah.
So there's some study that show that
yes. Conflicting, polarizing studies.
And high blood pressure can take 1 or 2 sachets of Ura.
Well, I think that 1 or 2 sachets, because as I mentioned earlier on to you, out of these 4 grams per sachet of Ura, only about 0.6 grams is actually sodium. So it's very, very low. So I don't think it's actually an issue. Yeah,
so it doesn't matter.
Uncontrolled hypertension, then it's probably a different story. Yeah.
Another question also related to uricase deficiency. Can we do blood tests for that?
Uricase deficiency, yes.
Yeah.
Yes.
We can
That's
do
how
like,
you find out.
That's how you find out.
Yes.
The combination usage of Ura and allopurinol can be used how long to excel the uric acid stone?
If you were to talk about the uric acid stone, if it's really purely because of the uric acid stone, most of the time we will try it for about 1 month or 2 months, and of course it's depending upon the size of the stone as well. If you are talking about small stones, it probably disappear within a month or 2. But if you're talking about a full stack horn calculi where the stone is filling up the whole of the kidney system, that may take months before it dissolves. So you have to actually follow up with frequent ultrasound. You're not going to subject the patient to go for a CT scan all the time. Maybe frequent ultrasound to assess the size of the stone is advisable. But mind you, most of the stones are not purely uric acid or even calcium oxalate or calcium phosphate. It's a blend of everything. So if you are thinking about using the allopurinol or even the Ura to dissolve the uric acid component, you may actually make the stone a little bit smaller, but the calcium phosphate and calcium oxalate stone element are still there. So you are still not dissolving the whole stone unless the stone is purely a uric acid stone.
Most of the time it's a mix of different colors.
Most of the time it's a mix.
How to differentiate actually?
Well, you can't really tell.
Can't really tell. But
unless you send for stone analysis.
I see.
Yeah.
Okay.
Well, one quick short answer for that is that the uric acid does not show up on the X-ray. So when you do an X-ray, you see the stone is this size. It's like very small. But when you do a CT scan, you see that the stone size is quite big. Then you know that the one that you can't see on the X-rays is actually the uric acid element that you fail to pick up.
So that's one of the ways to differentiate.
That's right. That is a short answer for that.
To rule out.
Yeah.
Okay. Can Ura be used for acute gout attack?
Well, I think that the URA is basically an alkalinizer. So acute gout attack, I usually will use colchicine. And URA is harmless because it actually helps to alkalinize it. So ultimately, gout is because of the high uric acid level. So to me, I will actually use the URA together with colchicine. And when it comes to this maintenance therapy, I will switch on to allopurinol together with the URA.
Allopurinol plus URA.
Yeah.
So there is no harm using that.
Yeah.
Okay. What is your experience in using URA in children with stones?
Well, I think the URA is actually not advisable or not advocated in the product insert, I think less than 12 years old. But at this moment of time, we do have small children who have recurrent stones. And if they have had the metabolic workout done, then we will still give, but very tiny dose, like about 1 sachet or something like that, but we won't actually escalate. But this is, of course, just from the personal experience. But in the product insert, we're not supposed to use it for small children because we have no studies for that so far.
Small mean less than
12.
Less than 12.
Yeah.
Okay, let's see. Is URA safe in CKD patient?
Well, I think this is a good question because, as I mentioned to you, CKD patient, anuria patients, they are contraindicated for URA. So it filtered through, all this end product filtered through the kidney. That the uric acid, the urine end product filtered through the kidney. So when you're using the URA, you can actually further aggravate it because those patients, that there are a lot of electrolyte imbalance. So I usually will not advise the patient to use the URA if they have this renal problem or CKD in any form.
So it's contraindicated.
Yeah.